So every year, thousands of people undergo either hip, knee, or shoulder replacement surgery. But now more people are opting for a different solution, a way to kind of put off such an invasive procedure. It's called joint preservation. So joining us this morning is Dr. Stephen Lalis with Northeast Florida Orthopedics, and he just opened up a joint preservation center right here in Jacksonville. So thank you, doctor, for joining us this morning. I appreciate it. So that can be kind of invasive, and it's really good to have another option. Can you explain just what this other option is?
Well, some of the problems we have today are that, total joint replacement surgery is becoming more and more common. People are living older, living longer, and are doing more damage, more exercise, more damage to their joints. And the prediction is that we'll have about 3.5 million total knee replacements per year by the year 2030.
Wow.
And that's an awful lot. And the thing about total joints replacement is that it replaces, of course, the entire joint. Well, a lot of times only part of the joint is damaged, such as like in the knee, you can have damage to just a portion of the knee. The knee joint actually has 3 separate segments.
Okay.
There's an inside joint, there's an outside joint, and there's a joint between the kneecap and the thigh bone. And if only one of those joints is damaged, we can replace just that portion of the joint. And so you can have, instead of having a complete knee replacement, like this model shows, where the entire end of the thigh bone and the top of the shin bone are replaced along with the kneecap, you can actually replace it with small portions. So you can have a very small portion of your knee replaced, only the inside part, only underneath the kneecap, whatever's damaged. And so some of these joint replacement surgeries involve only partial joint replacement. There are other opportunities as well. Special training in cartilage transplant. So you can actually transplant or replace the knee with human tissue, with cartilage and meniscus material that actually saves your knee, replaces it with biological or normal tissue. So you don't have metal and plastic in your knee, you actually have cartilage and bone, which is much more natural.
What does it mean for the patient, though, when they're going through this, getting just the part they need replaced as opposed to this whole thing? What's the process like for the patient?
Well, the nice thing about it is it's very beneficial to the patient because the recovery is so much faster. Also, the risks involved are much less. So your incision is smaller, your recovery again is faster, the pain is less. The chance to have a blood clot in your leg or infection or healing problems with the incision are a lot less with a partial joint replacement or with cartilage or meniscus transplantation.
So what's the process like leading up to it, determining exactly what needs to be replaced and the best way to go about it?
Well, what you need to do is you need to find a surgeon who is adept, who's very practiced in these kind of techniques. And that person can actually determine how bad the cartilage damage is in the different parts of your joint. Is it the entire joint? Is it just part of the joint damaged? There are special x-rays and MRI that can be performed to look for these things.
Go ahead.
And then what you do is you discuss with your surgeon the different options. And having these potential options are very, very important because if you preserve as much part of the bone that you have, it's better long term. Every total joint replacement will fail eventually. Eventually, the particles that wear from the plastic and metal that are articulating, that wear will cause your body to reabsorb some of the bone around that implant. And the #1 failure for replacement of joints is wear or loosening from wear, aside from infection. So once you have a joint replaced, you have to get x-rays and monitor this very closely. Well, with partial joint replacement, you can imagine instead of having an entire large portion of your bone replaced versus a small portion with a lot of plastic in your knee, that's more wear particles, and that'll wear faster.
Sounds like a great option. And so thank you. Is there anything else people who might have any questions that you want to share with them?
Well, again, you need to understand that there are many options. So if your surgeon has told you that you have no option except to wait 10 years to get your joint replaced because you're too young, there are other options. There are cartilage transplants, meniscus transplants, those kind of things. There's also special bracing and other non-surgical techniques can be used. And so you need to find a surgeon that is really practiced in joint preservation surgery.
Cool. Well, thank you. And of course, if you want to check out any of the things that we talked about today, or you want more information on the surgery, how you can book an appointment, there are 2 practices that you can check out. First, the Northeast Florida Orthopedics, that's on Argyle Forest Boulevard, and then Dr. Lalis has another one in Fleming Island. Thank you so much for joining us. We appreciate it.
Pleasure. Thank you for having me.